Ontario is second to Quebec when it comes to the number of COVID-19 cases in this country. The Ontario government is now turning to former Liberal Minister of Health, Dr. Jane Philpott, to help develop the Ontario Health Data Platform to really better track the spread of the virus. Dr. Philpott is joining us from Stouffville this morning. Good to talk to you this morning.
Good morning. Nice to be with you.
Okay, so walk us through this. How will this new health data platform be used to track the virus?
Well, as you know, information is critical to be able to stop the spread of COVID. And we have buckets of health information in all sorts of different places. So there's health data in hospital records, in emergency departments, in laboratory information, and public health data, and family doctors' offices. And it's all sort of in these different silos. And we've struggled over the years to figure out how to make a cohesive health data system and be able to use it in a timely way. Well, like many other things, COVID has really pushed Ontario to say this is the time to actually put those big databases together, provide access to researchers and data analysts and decision makers so that we can understand where the outbreaks are happening, who's at risk, which populations are most vulnerable. And it's an important project that has been a long time coming, but certainly the pandemic has brought it to the fore.
Unlike BC and Alberta, Ontario has not shared the regional testing numbers. What challenges has Ontario faced in response, do you think?
Well, like every part of the country, it is the virus tends to have outbreaks in specific regions. We've absolutely seen that in Ontario, and it's often associated with institutions, congregate settings, workplace settings. We've recently had some very bad outbreaks in that regard. And getting this kind of information rapidly and collating that data, it has been tricky to date. There needs to be some standardization about the kind of data that's coming in. We have 34 different public health units in Ontario, and they're all working really hard to be able to try to get this information out, but doing it in somewhat different manners, and that makes it really hard for people to get an accurate and up-to-date picture on what's going on. So hopefully the health data platform will be one of the drivers that will make that possible very soon.
I want to ask you about your personal experience throughout this pandemic. You worked in one of the hardest hit nursing homes in the province that was dealing with a staff shortage because of COVID-19. And now following the military report detailing the allegations of the horrific conditions in some of these homes, what was your experience like? What did you see, and what needs to change?
Well, the place that I was working was not actually a nursing home. It was a group home. So it was a home for adults with severe disabilities, developmental, intellectual, and physical disabilities. And some of them have lived there for 20, 30 years. So some of them are elderly, but not all. Mm-hmm. They had a terrible outbreak. Out of 42 residents, 40 of them were positive with COVID. 57 staff members were positive. It certainly was off people's radar in the early stages of the pandemic to look at these congregate settings and realize how at risk they were. And they were severely short-staffed. So I've certainly been one of many who have welcomed the report that the military has put forward around long-term care facilities, and many of the same issues exist in other types of residential facilities, including shelters and group homes. And one of the realities is we have to find a way to make sure that workers are protected, that they only work in one facility, that they have the equipment that they need, and that these outbreaks are stopped right at the very start and ideally prevented in the first place.
Dr. Jane Philpott, we appreciate your time this morning. Thank you.
Thanks for having me. All the best to you.
You as well.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.